I'm Dr. Rick Greene, and it's my pleasure today to be the host of this edition, which really honors the 100th anniversary of the Commission on Cancer in a video interview series. And today it's my absolute pleasure to be hosting and talking with a colleague, a friend who I have known for many years, Dr. David Winchester, who was medical director of the cancer department at the American College of Surgeons from 1985 to 2018. Dave, welcome.
Thank you so much, Rick. And before we get started, I just want to acknowledge all the contributions you have made in the cancer field. And you've been a past chair of the Commission on Cancer and a distinguished leader in the field of cancer, known nationally and internationally. And I'm really honored to be able to relate something of what I've tried to do to you. So thank you so much, very much.
Well, I appreciate those kind comments. Thanks, Dave. You know, I first want to talk, there's so many things that we could talk about. You made so many contributions to the cancer department, the Commission on Cancer, the AJCC, it goes on during your tenure. But I do want to start with something that I know is near and dear to your heart. I really first met you, I think, when I was going to sort of national meetings with the American Cancer Society. You were very much involved in the national level, of course, and the unit level in Illinois. But your melding of the American Cancer Society and the cancer programs, I want you to talk a little about that vision that you had, which ultimately led to the NCDB, National Cancer Database, being founded in the late 80s.
Well, if you'll forgive me, I want to just start with something else, and that's the morning of the loss of John Daly.
Yes, a great loss just a couple of weeks ago prior to this interview. And we did have the wonderful opportunity to interview John prior to his passing.
Oh, good.
He was a wonderful CoC chair. So thank you for bringing that up.
Yeah, he was a chair in the mid 90s or so. He made major contributions in cancer standards and cancer staging and cancer liaison, lots of things. And we will miss him greatly, but he's a great leader and a great surgical oncologist. He was a dean of a medical school, goes on and on. So thanks again to John Daly, and we miss you. Yeah, I was very active with the unit and the National American Cancer Society for years. And I did have a chance to get to know Jerry Murphy pretty well, the late Jerry Murphy. And in the late 80s or mid 80s or so, Jerry and I had conversations about how the two organizations could work more closely together. They'd done so for years. And we had an opportunity to strengthen that union, which I think we were able to do. And we talked about establishing a clinical national cancer database back in those days. And I have fond memories of going to New York City to present to the National Board of the Cancer Society the initial ideas that Jerry and I had put together about a national cancer database. Surprisingly, there were many people at that meeting of the full board that were very much in favor of the idea, but there were a few that were not in favor of the idea. And it took a little while to make our case for establishing what has now become the world's largest clinical database. And it's not an NCI program. Which is more of a different kind of program. This is a clinical database, as you well know, and it has grown through the years and has a lot of information about clinical cancer and its optimal management. So it was a real step forward in working with and being funded by a cancer society for the National Cancer Database.
Well, you know that the concept is so beautiful because it really melded our CoC accredited institutions. And it really depended on the registrars. And why did you even feel that would be a mechanism that we could use? Why did you think that would be successful?
Well, I guess I didn't come up with the idea myself, but I contributed to it, but it seemed like an ideal opportunity to take two major organizations that had the same vision about cancer and its management, and it would be able to strengthen and actually be a synergistic relationship between the Cancer Society and the cancer programs of the American College of Surgeons, the centerpiece of which was the Commission on Cancer. So it seemed like a natural. It didn't seem like natural after that initial meeting, but it did move into that eventually, and we were able to establish the National Cancer Database.
Well, as you well know, we have 37 million cases in the NCDB today, and thank you for that vision. I want to also ask you, because the strength of the Commission on Cancer, in my view, has been the member organizations, bringing member organizations in. And I wonder if you talk a little to that and your involvement and some of the member organizations that you feel have been especially important to the Commission over the years.
Absolutely. Well, as you well know, the Commission on Cancer was one of the first programs of the American College of Surgeons, established in 1922. That was only about 9 or 10 years after the actual establishment of the college. And now it has, I don't know, over 110 individuals with 58 or 60 national organizations that are involved in cancer: the National Cancer Institute, the Society of Surgical Oncology, American Society of Breast Surgeons. It goes on and on. And that's what makes it really strong, because it's not just a thing that the college is trying to do with the Cancer Society. It's a national effort. We've had a lot of cooperation and input, involvement with those 110 individuals through those 58 or 60 national professional organizations. So it's been a real honor to be able to see that grow. I won't take credit for that. That credit goes to many, many individuals professionally, including yourself. Also would take this opportunity to acknowledge our very strong cancer department staff at the American College of Surgeons, and particularly Connie Burrow, who is now the manager, the administrative manager of the cancer department. I have fond remembrances of Connie when she first was at the college. When I first came there, she was the secretary, and then she was something else, and then something else, and then something else, and eventually she was the boss. And I considered her my boss when I left, with a few others. I also would mention the executive directors of the college and the important role and support that they played in not just the National Cancer Database, but the entire cancer program, starting out with C. Rollins Hanlon, who called me back in 1982 or 3 or something like that, and said, "Hey, Dave, could you come down to the college and talk to me about something?" And of course, at that time, I was president of the staff of my hospital, and I was involved in Cancer Society, many other things in my surgical oncology practice. And I thought, I have a great deal of respect for Dr. Hanlon. I've heard of him, met him briefly. So I went down to the college just to sort of fulfill my obligation to say thank you for calling me. And I became medical director of the cancer programs about a year later. So he had his way of persuasion that was really terrific, and he made great contributions to college, along with Paul Liebert, Dr. Paul Liebert, and Dr. Tom Russell, Dr. Narwald for a brief period of time, and then now Dr. David Hoyt, who's been director for just over 10 years. But so I've had the opportunity to be accountable to 5 executive directors of the college, which has been a real learning experience for me and a real great honor.
Absolutely. And it's nice to know that Connie Burrow is still there, right?
She is. I thought she might be on this video, but I will be sure and say hello to her.
Absolutely. I'll ask you another area of interest for you, you mentioned, was the Cancer Liaison program. This was an incredibly important program from the grassroots. I wonder if you'd talk a little about that and your view and what you brought to the CLP program during your tenure.
Well, it's well named as a cancer liaison physician, because you become a liaison between the cancer programs of the American College of Surgeons and the local hospital. And that program grew by leaps and bounds, and I think was one of the important steps forward in our relationship with individual hospitals, because it really personalized that relationship between the cancer liaison physician and the so-called cancer committee of the hospital. And that has been nothing but successful. It's really been a terrific program.
Right. And of course, we have multi-layers now. We start off with the individuals still at the accredited institution. We have a state chair program. And of course, as you had something to do with, the American Cancer Society supported the CLP program for many years.
Indeed, and I had the honor of being a cancer liaison physician myself in earlier years, and learned a great deal from that.
Right. Another area I just wanted to touch on, which is so important, really is the clinical trials program initiated in the college. The American College of Surgeons Oncology Group, ACOSOG, you were instrumental during your tenure in bringing that forward. I wonder if you talk to that for just a moment.
Sure. We learned through the years, as we were exposed more and more to the art of cancer care, that the clinical trial was such an important element in moving the progress forward, because it became a real life mechanism for testing a hypothesis in real time with a number of volunteers and with people. And it was the gold standard of establishing, yeah, this is good, or no, this is not so good. And through the years, that has become, even today with the COVID-19, look at the clinical trials that preceded vaccinations and the progress we're making in that. So it's just COVID-19 is a good example, in addition to cancer, where there is a mechanism for thinking forward, having volunteers who are willing to be control groups or experimental groups. It's not a perfect science, but it's a darn good science. And I'd say it's highly respected by most.
You know, you've published so much. Of course, you have been instrumental in using the NCDB data over the years. Many of the papers, and by the way, we're going to be featuring many of the best NCDB related papers during the 100th anniversary.
Oh,
and
good.
So this is a feature of our 100th anniversary. But one of the publications that I particularly enjoyed, because you got me involved, was the tumor conference or tumor board textbook that you put together. And I wonder if you talk about that for a moment, the importance of our tumor conferences.
Well, they are certainly, they have endured. They have still persisted, even if it has to be done virtually with the COVID epidemic. But it's always been a strength of the program to be able to get together in the same room, medical oncologists, radiation oncologists, nurses, and surgeons, surgical oncologists, and to talk specifically about Mrs. Smith, who has such a problem, or Mr. Jones, who has this problem, to be able to project X-rays, project slides from the pathologist, and then have a multidisciplinary discussion of, what are the options for treatment here. And there's quite a bit of discussion about that, and we never can entirely come to consensus about it, and that's the way it ought to be. But more often than not, we do come to consensus at the cancer conferences. It's an extremely healthy way to promote collaboration among the cancer care people, including nurses and physicians. It's an ideal way to be able to talk to one another and to come to some conclusions. And then the managing physician takes over at that point, or managing physicians, if it's more than one type of treatment. They take the treatment forward. The tumor board doesn't take it forward. They get the results afterwards, and they're able to reflect upon their decision to do treatment X or treatment Y, and to be able to look back and say, well, yeah, we kind of leaned, or we did definitely direct that form of treatment. So it's a really a thing in the hospital now, which is just part of the hospital's cancer program. It's so important.
Yeah, the concept of multidisciplinary care and bringing groups together and teams together. And I think, again, I congratulate you on that. Again, one of the things I want to touch on, you've been very supportive over your career of registrars, of registrar education. I wonder if you talk to that for a moment, your involvement in our registry colleagues.
Yes, indeed. It's so important, our tumor registrars and our tumor registries and the National Tumor Registrar Association, the NTRA, I believe it's still called, although names do change. But I went to many of their national meetings and was able to make presentations at those meetings, and I collaborated closely with the leadership of the registrars. And I can't underemphasize the importance and the relevance of being able to keep track of what patients are doing. And they're followed carefully by the tumor registrar, which is a central part of the program of cancer program at a hospital. And they're able to give periodic reports, which are always going to be illuminating for the clinicians caring for the cancer patient. Yeah, the tumor registrars have been very innovative too in terms of the data set that they keep. It's been expanding on and on. And the information that they have and they present at their national meetings and their local meetings is invaluable for the multidisciplinary management of the cancer patient. And I would just add that we do consider the word multidisciplinary in cancer care. Don't forget the tumor registrars, they are part of it.
Well, I remember fondly the day I got a call from you and you said, Rick, would you like to head up a work group that would like to revise the Ford's manual?
Oh, yes.
And I didn't step back fast enough. And so that, of course, as you know, became the STORE manual. And I wanted to tell you that, of course, we have the coding that captures the COVID-19 pandemic data.
Good.
So under your leadership, Ford's and the DAM and all of those things were so important to our registry community.
They were indeed. I'd forgotten about that, but it's certainly of central importance. And it's now what, about the 5th edition?
Oh, yes. Yes. Ford's has now become STORE, as you know, Standards for Oncology Registry Entry.
Right, right.
So Dave, as we close this interview, I want to give you an opportunity to talk about anything, bring up anything that you think I've missed that you feel was either a challenge or feel was something really that was part of your legacy.
Well, I think that's a hard question to answer because there's so many things going on in the cancer department at the college. But I think the NAPBC, the National Accreditation Program for Breast Centers, was something we came up with the idea some years ago, presented it to many different people within the college. Interestingly, there was actually 2 or 3 of the regents did not like this program. They objected to it. And I remember being called into Tom Russell's office one day saying, you're acting like an antenna here, and it's not a good thing. So just slow it down here a little bit. So of course I didn't, and had more and more people come along with the idea that they thought this was a good idea. Actually, I made a presentation at the National Accreditation for the National Breast Program.
The ASBS?
Yes, and yeah, American Society of Breast Surgeons. Thank you. And there was a fair amount of objection from the audience at that initial presentation. And so it took a while for us to get this off the ground, but we did indeed, with many contributors and collaborators, were able to move this along. And it's now become, I think, a pretty well-established program for the National NAPBC, which I have no idea what the present number is, but several hundred hospitals have become NAPBC accredited. And it's a rigorous progress. They are surveyed, they are checked for their standards and their adherence to standards, their results. and so on, and the multidisciplinary care of the cancer patient. And so I think it's been a real advance for the breast cancer patient, male or female. I also would point out that the National Accreditation Program for Rectal Cancer was done before I left, and had a lot of support for that. Initially, not a lot of objection to it. I don't know what the number is now of how many centers are NAPRC accredited, but then the Clinical Scholars Program was established. You'll recall Carl Billamore was the first clinical scholar. Carl, an outstanding surgical oncology leader, and there have been many clinical scholars since then. And you've already mentioned the Ford's Manual, which has been of central importance. And then I just finally say, in addition to many other programs, the AJCC has been a very important part of the whole picture. And that is that we've learned that accurate clinical pathologic staging of the cancer patient is really important to come to the right conclusion about prognosis, treatment, and outcome, and so forth. So hats off to all those programs. They have been, I think, a real step forward. And I know I'm excluding others. I don't want to, but we have a certain amount of time here, so I don't want to take too much time.
Well, Dave, your legacy is without bounds. And so I want to thank you for everything you've done for our cancer program. I have learned from you over the years, and I thank you for your mentorship. And I just want to say that it's been such an honor to interview you today for this program.
That's a reciprocal acknowledgement. I thank you very much for your good friendship, your mentorship, all you have done to contribute and give me ideas. And it's been a great relationship, and I really want to thank you.
Have a great day.
Thanks so much, Rick.